The House of Representatives is set to host stakeholders in the health sector on a number of health-related bills. Now, one of them is a bill for an act to amend the University Teaching Hospital composition of boards. The Nigerian Union of Allied Health Professionals is one of the leading groups in the health sector, and they have released a statement on this bill. Now, to look at this bill, we are joined by the President, Comrade Dr. Obinagbona. He joins me on the news to share the union's thoughts on the bill and why it is desirable. Good to have you join us, Dr. Ogbona.
Good afternoon. Thank you for having me.
So we've seen
good afternoon, Nigerians.
We've seen the National Assembly, especially the House of Representatives, make an attempt to reform the health sector, especially during the COVID-19. We've seen a number of bills being considered at the House of Representatives. But tell us more about this particular bill and the gap that it hopes to fill.
All right. Thank you very much. This bill, as sponsored by Honorable Bamidele Salami, is a welcome development. It's one of the dividends of democracy. As you know very well, in the year past, for about 37 years now, there had been many bickerings and unrest in the health sector. And if the remote cause is to be traced, you will discover that it is the Decree 10 of 1985, which is now known as Act U15 LFN 2004. That decree was promulgated in 1985 during the reign of President Muhammad Buhari as the head of state. So it's a tool that has caused disharmony in the health sector. And for the National Assembly to consider it for review or amendment now, it's a welcome development. The bill is looking at 3 or 4 major areas. The first one is the issue of the headship of the hospital. What should we call the heads of the hospital? Here and now, we refer to them as chief medical directors. But the bill is trying to look at that nomenclature to call that position chief executive officer's position, because when you occupy that position, you are a manager. You are not necessarily practicing your profession or your skills as a healthcare practitioner or professional. So, secondly, that bill is also trying to review the aspect of the appointment of who the chief executives should be. Hitherto, presently as we have it, it is only the medical practitioners alone that are allowed to vie for the post of that chief executive officer of the teaching hospitals in Nigeria, shutting all other competent clinicians and professionals from taking part. That is a sign of discrimination. And the ILO Convention 111 is against discrimination. Even our 1999 Constitution as amended is against discrimination. We are not supposed to be discriminated against, either by gender, profession, or our calling. So it should be made open to all qualified, competent professionals to apply for. Then thirdly, that bill is also seeking to correct the lopsidedness in the board composition of all the teaching hospitals. As it stands today, out of a 13-man board, 8 to 9 members are from one professional enclave. And 95% of the people who make up the workforce is only one person that represents their interests. So it is lopsided and skewed to one professional constituency, so it's not the
Absolutely,
best.
Dr. Gbona.
Moreover,
It does seem, I mean, from your concerns, sorry to interrupt you, but I know there is a fourth thing that the bill seeks to address. But it also looks like you are concerned that it's just the medical doctors who seem to be at the helm of affairs in the teaching hospitals. But let me ask you, because you seem to be disagreeing as well with the Dental and Medical Consultant Association on the bill. What's your disagreement with the Dental and Medical Consultants Association?
Yeah, the disagreement is what their publication is trying to misinform the public. The international best practice now does not restrict the position of the chief executive to the medical practitioners constituency alone. 2 days or 3 days ago in Kenya, the Kayeta Teaching, Referral and Research Hospital just appointed a nurse, Mr. Hamed Dagane, as the chief medical director of that hospital. Other countries like UK, Australia, and thereabouts, even Germany, even Ghana here, their chief executives are not medical practitioners. Mm. So in this wise, if this is done, it is the Nigerians that will benefit more from it. Because if you look at our ranking now, out of 191 nations, we are 187. And under the watch of medical practitioners as the head of this teaching hospital. We are not trained
I'm sure, sorry,
managers in that direction.
But I'm sure the medical practitioners will also say government has a role to play in all of this. We are following this bill and following your concerns as well. I'm sure we'll have you again as they pass different stages of reading at the National Assembly. Thank you so much for talking to us. The President, Nigerian Union of Allied Health Professionals, Comrade Dr. Obinna Ogbonna.